afternoon, ladies and gentlemen, and thank you for joining us today. My name is Nicoyanne Roberts, and as we begin, as Manager for Nautical Development at the Grenada Tourism Authority, I ask you to look at this informative video, which shares some of the sentiments of our stakeholders, our vendors, our taxi drivers, as we look forward to restarting our cruise industry for the 2021-2022 cruise season.
Really bad.
My name is Garfield St. Louis. This pandemic affect my way of life very bad. On a scale of 1 to 10, it reached down to about 3. You understand? So it affects me really bad, you know.
COVID-19 has impacted our business at the Grenada Craft and Spice Market tremendously. In so doing, we were not able to do business for almost a year and a half.
That affected the business. We didn't have nothing at all. A lot of my goods are spoiled. I had to throw it. And then I didn't have money ready to renew anything again.
As one member already said that we has out of business for almost 2 years, but we were hoping, thank God.
Really bad. I don't think it could be worse.
Because it's a year and months now that our business is closed. We did not get no business. And if the season is about to start, we'll be happy because bread will be on our table.
Good morning. My name is Anthony Bargott. I'm a member of the NTA. We are happy to know that the cruise ship season is going to start again, because after almost 2 years, as everyone is stating, that we were out of business.
And it is good for us. We're really happy to know that it's starting again. Thank you.
In the context of doing business in the tourism industry. As a result, with the new coming of the tourist season, I think it is exciting and one that we look forward to in relation to getting back in the same manner of action and business that we are accustomed to.
And we want more cruise ships to come to Grenada. We want to ask our please, we're begging our please, all our cruise ships to come to Grenada because we need them. We need them to be able to get something to go by.
Once the cruise ship come in and people visiting the place, that should help. You know, everybody wouldn't buy, but some will. So that would be a good thing.
I'm looking forward for the cruise ship start rolling back in the future. Thank you very much.
You have listened to the concerns and the feelings of our stakeholders. And I now ask our Minister for Tourism to speak with you. Dr. Clarice Modeste is a medical doctor who has served her country in this profession for the past 2 decades. She has worked tirelessly as a Minister for Health and the Environment on 2 occasions, and as Minister for individual portfolios of Works, Foreign Affairs, Tourism, Civil Aviation, and Culture. She has always insisted to our teams in placing more emphasis on community tourism to provide variety and memorable experiences to all our guests. She believes that the crisis brought on by the COVID-19 pandemic should be used to explore innovative ways to use for the benefit of the industry and all its stakeholders. It is now my pleasure to introduce to you the Honorable Dr. Clarice Modeste, Minister for Tourism, Civil Aviation, Climate Resilience, and the Environment, to address us on the safe restart of Grenada's 2021 to 2022 cruise industry. Madam Minister.
Thank you very much, Mrs. Roberts, and a pleasant good morning to everyone listening here, listening to us from here, GTA's headquarters. I hope we have all of our various media houses here and whoever else has an interest in what we're going to say. The first thing I wanted to speak about is the reality. What is the reality? Reality is that a pandemic has hit us. due to no fault of ours, but has impacted us negatively. It has battered us globally, regionally, and this little beautiful rock of ours has suffered tremendously, just like everyone else. And while we see other industries have rebounded or are well on their way to recovery, the tourism industry is still struggling to do so. The reality also is that tourism contributes significantly to the economy in Grenada, and that there are many persons who are employed in the industry directly and indirectly. Some say 5,000, some say more than 5,000, but in our 100,000 tri-island state, 5,000 is significant. And I'm sure if we did the maths for the indirect beneficiaries, we will find that the numbers would increase. So at this point as we speak, and the video attests to that, a number of persons have been displaced from their job and continue to be so. And it is our responsibility, the Ministry of Tourism, Grenada Tourism Authority, all other players who are involved in the industry, and the major stakeholders, and of course our government in our background, to ensure that we resuscitate, we revive the tourism industry in our country. The reality is that tourism is a service. We serve people with different likes and wants and tastes, and we either pander to them or we stay out of the industry. That is the reality. And so it is a service-oriented business. It is competitive. It is competitive within countries. Persons will decide which tour they want to go to. If they are stayover passengers, they will decide which accommodation they would go to based on a number of factors. But also it is competitive between destinations, so that persons will decide whether they come to Grenada or whether they go to another island, depending on what reviews the destinations would have had, and depending on the experiences that these persons would have had in our country. So they will decide where they go. So the reality is that we, as the service providers of the pleasures, of the experiences, we have to work together as one body, all of the stakeholders, to make our product, to make the enjoyment, the experience, a memorable one for persons who come to our shores. Because in this day of information technology, the good experiences will be shared, and also the bad ones would be shared. And that is the reality. My dear brothers and sisters, a few months ago, during the summer period, those of you who know a bit about tourism would realize that tourism really, it is really highly active during the winter months. So it starts about November. We don't have winter, but of course, our visitors generally, by and large, they have winter and summer and spring and everything else, autumn. And it's sort of seasonal, so it starts up in November, pretty much, and it ends around March. And I am looking at an itinerary here, which I will just mention briefly. I know the others who will follow me have much more to say. But a few months ago, we had an offer for summer cruises. And we were ecstatic. We were happy because it was a year and a half since we had nothing happening from the cruise side of our business. And we were happy. And we started to work towards that, but there were some stumbling blocks. One of it was the low level of vaccination uptake we had in our country. And compared to others, we were very low on the totem pole. And that was a factor, a safety factor that had to be dealt with. The other one was that we had protected our borders so well, and by implication, we had protected our people and the health and safety for our people, so that as we kept them safe, which was a huge benefit, but the lack of exposure also to the virus couldn't confer on them the natural immunity that could be had to some measure. And therefore, after back and forth dialogue with the cruise lines, back and forth dialogue with health and so on, we determined that it was not a safe period to let persons in on our people, and sadly we had to turn it down. It meant that the calls that were destined to Grenada were distributed to other destinations, and that is how business works. You don't want it, somebody else is waiting there in the slips to catch it, and they did. So we now we have again been approached, and I am looking at the itinerary, very significant, which starts as early as tomorrow, Tuesday 9th. We have 10 calls from the Clipper, and the other one, it starts on the 12th of November, and there are quite a few for November, calls for November, significant amount for December, January, February, very significant, March, and April is not too bad at all, but May we have one. We have one. But this is over 200 calls. Most of the cruise ships will bring in thousands of persons. Of course, everyone will not be able to or desire to disembark, but we have to prepare for all of those. I just want to mention briefly that while these calls are offered to us, and very likely will happen, there have been discussions on both sides, the Grenada side, GTA, Ministry of Health, and others, tour operators and so on, and the cruise lines. The cruise lines have come up with the protocols. In general, what they have said is that all of the crew would be fully vaccinated, that the guests would be, the majority would be vaccinated except for children who are under 12. Some have said that everyone would be vaccinated, 100%. And some have said those who are under 12, and you would understand the implication of under 12, because up till recently there had been no vaccines approved for children under 12. And up till now it's still a bit of a toss-up as to whether the age would increase in the very near future. But generally, it is a fully vaccinated scenario. And there are reasons for it. Because it has been proven, and persons talk about statistics and data and the reality is it has been proven that persons who are vaccinated, they run less risk of getting the disease. And if you have less risk of getting the disease, then you have less risk of spreading the disease. And even those who are a small percentage who do contract the disease, then it's much milder, so you do not have all of the kinds of illnesses, and you do not have the deaths that have been registered in the persons who are unvaccinated. And this is corroborated worldwide. It's not just Grenada statistics, it's all of our islands around us, it's further afield globally. This is what the statistics are showing us. So coming back to the agreements and the protocols, on their side, they're having fully vaccinated. On our side, we have agreed with them that the persons who they interact with, because if you're interacting with a vendor, if you have a driver of a taxi or a cruise, the cruise buses and so on, there's some measure of interaction, or there's some possibility of touching what somebody else has touched. And so there's a possibility of infection. And so one of the key priorities for visitors is safety and security, their health. And so they're asking, you're asking us to be vaccinated. Are the persons we're going to for service in the various destinations, are they also vaccinated? And we have had to say that we would endeavor to ensure that everyone is. So, as any service, the person who wants the service makes demands, and the person who provides the service either meets it and gets the customer or loses the customer, and the customer will go wherever the service is. In this case, this is what it boils down to. So our government has said it is not making vaccines mandatory, and we continue to observe that. But the reality is, people will make their choices. Do you want to get vaccinated? Do you not want to get vaccinated? And the visitors who are fully vaccinated, and I want to include here the stayover passengers, they would demand that the persons who attend to them are also fully vaccinated. Already persons are telling me that some of the tours, the small tours that are being operated here through the accommodation sector, that they go only where they know persons are fully vaccinated. So the choice is there. You make your choice, but certainly there are consequences and there are results either ways. And that again is the reality. Our fear is that if we do not take up all of these, over 200 calls that are being offered to us, there are other persons, again, as happened in the summertime when we had the offer, they will take it. And we have to ask ourselves, if we keep turning down these offers, for how long will these offers be open to us every season? Will they continue? Or will persons love the destinations that they have been exposed to and give raving interviews of them and encourage others to go to those places? So this is where we are. A lot of work have been done. Commendations to all of the stakeholders, commendations to GTA, our CEO, Petra, to the head of Nautical Matters, Sister Nicoyan Roberts, our chairman of the board members. Everyone has pitched in and assisted in the dialogue between the cruise ships, our Ministry of Health, and our people on this side, to the point where we have made some commitments, we have made some promises to them that we're saying we agree with, we concur. If persons are not vaccinated, then we will ensure that let me put it another way, that we will work with the service providers so that they become vaccinated so that they can provide services. And in the meantime, that's where we are. I want to commend all of the facilities, all of the attraction sites that have gone ahead and taken the vaccines and are ready for it. We at the Ministry of Tourism, we're responsible for Fort Frederick, we're responsible for our Grenada, and we have ensured that the persons there are ready to provide services and so on. Some more details I'm sure would come there, but I'm just trying to give an overview of where we are. And we have one or two minor nuts and bolts to put together, and I'm sure within the next 24 hours we will certainly be ready with all of the details, so that by next week we will be in full, how shall I say it, full operations where the cruise ships are concerned. Because if we don't, and I just want to remind persons that once we lost a cruise line, which has a number of different, we lost a business with a certain entity that had a number of cruise lines. And for about, my recollection is somebody told me 15 years, they never came back. They will not keep knocking on our doors if we do not respond in a positive way. There are options, there are choices, even within our region where they can go. There are other regions that they can go to. They will just go. That's the nature of the business. And regardless of how otherwise we would have liked it, this is where we are. So as I said again, commendations to all who have played a role. I know our government is very concerned about the level of unemployment that this situation has caused in our country, and we are willing to work with all stakeholders to see how we can improve, but time is of the essence and the right actions need to be taken. So I thank you, and I will now hand over to Sister Nicoyan again, and I'm sure you will hear a lot more from others.
Thank you, Madam Minister, for reviewing the current realities with us, our international cruising service demands, and the requests being made concerning safety from our prospective cruise line guests. It is now my pleasure to introduce the Chairman for the Board of Directors of the Grenada Tourism Authority, Mr. Barry Collymore.
Thank you. Thank you, Nikoyan. Honorable Minister, always a pleasure to be on any forum with you. CEO Petra Roach, members of the media, ladies and gentlemen, thank you for tuning in. I'm just here really in a support role, supporting the ladies at the table, especially led by the minister. And you know, this cruise effort has been led by the minister. In summer, when we lost those calls, I remember sitting with the minister, and I could see, you could see the literal pain on her face when we lost the calls, because she was at that time concerned about jobs. And she said to us, guys, when the cruises don't come, people don't work. And cruise shipping is about creating jobs. So she, and even before we lost the calls, because we lost the calls not due to anything related to tourism. We lost the calls because it was deemed by the health authorities. And, you know, in a sense, the government did its job a bit too well. We had the population protected so well. Grenada was without any cases, that some people believed that being in Grenada itself was a vaccine, that you could avoid COVID just by being here, and that, in fact, as some were saying, God is a Grenadian and COVID does not exist in Grenada. So that because there was no threat, there was no, despite all of the drives, the education drives, there was no real, many people felt no need to get vaccinated to protect themselves because we had no COVID. So the cruise shipping officials deemed Grenada as, and the health officials deemed Grenada as too much at risk. Our vaccination numbers were too low, and the minister continued our work. To be honest, I didn't see a way. I did not think we would be here today, because, and I said, Minister, I don't see it. She said, she said, well, let's see about that. And I said, well, whatever you do, we will support. But she got it done, and kudos to her, and support Nikoyan and Petra. But I have to call a spade a spade. It was the minister's lead that has us where we are today, and I want to compliment the minister for her leadership. And I think that for all of us have learned something from her, and certainly if you set your mind to something, you will get it done. And if it is one lesson from this, is we have certainly learned that. So I'm very pleased that we are here where we are. I think that the world in itself has entered. In 2020, we knew very little about COVID, so the idea was you had to have strong protocols to protect you. You have to have closing the border. You have to have all of these measures to protect you from COVID. We're in a scenario now where we have a vaccine, and the vaccine is working, and it protects persons well. And I challenge anyone who doesn't think that to travel. When you travel, people are out. People are out at restaurants, at bars, they're partying, they are living their lives normally. And they expect that. When they come, they don't want to quarantine. They want to go out. They don't want it to be under a curfew. They don't want any of that kind of thing, because that's not what they are. The rest of the world is open. And especially in our source markets. And we have to get there. A small country has a lot more risk because of the population density. So if you have, in places in the world, 1,000 policemen could be sick and it would not affect them. if you get 50 policemen sick here, or 30 dock workers, or 50 nurses, it could have a significant impact on the population. But the point is, folks, is that we have a vaccine now, and beyond that, I'm even seeing now and reading that there are pills now, and this may be our future, because a lot of people don't believe in preventing illness, we believe in curing sickness. So now there's some pills that you can take which they say they're coming, and they're experimental, and I think the Merck pill has been approved by the British Medical Council. But the point is that vaccination is the way to go, and it is no more clear that vaccination is the way to go in that the recent news out of the United States. You cannot, as a visitor now, you cannot enter the United States if you're not vaccinated. And if that is not a clear signal that, and sometimes small countries lead, we were one of the first probably in the world to have that stipulation, and now others are following. So sometimes we don't give ourselves enough credit. When Grenada was most dense, most highest COVID numbers I saw all over Facebook, everybody sharing it. Look at the world in data today. Grenada is the lowest in the Caribbean. Lowest COVID infection. I don't see people sharing that. So sometimes we have to give ourselves a lot more credit than we do. And but that was just an aside. I just want to say I'm really pleased that we have entered the phase where we are, where we can get cruise calls back. And I want to compliment the team that did it, and I want to say to all of my friends in the cruise industry who I've been speaking to over the last year and a half, who they have constantly, the stories are, many of us are comfortable because we have a salary every month, or we have income coming in every month and that kind of thing. And this is many persons in the cruise industry have not worked in over 2 years, and it is tough. It is extremely tough on them, on their families, on their loved ones, and I really think that I really feel pleased that we are where we are today, where we can have resumption of cruise tourism. So hats off to the minister and the team that led the effort. I played a support role, but I gotta give the minister full credit for this, and I'm really pleased that we are where we are. A friend of mine said something to me the other day, and I wrote it down, and he said to me, Barry, if we don't stop hiding from COVID, the rest of the world may forget our hiding place and stop looking. And it's a telling thing. If we don't stop locking up everything and closing down everything and pretending that the rest of the world is not going on. We had to do it, and we did it well when there was no vaccine, but there's a vaccine now. So we have to open up cautiously, carefully, let science be our guide. But I really believe that this is the time now for personal responsibility. Get vaccinated, wear your mask, social distance, and live your life. Thank you.
Thank you, Chairman Collymore. You have spoken to us and continually support us and the GTA team. You have recognized Minister's tenacity in not letting go of our focus on using science to help us deal with returning to safe livelihoods whilst living through the COVID-19 pandemic. We appreciate what you have done with us today. It is now my pleasure again to introduce the Chief Executive Officer of the Grenada Tourism Authority, Ms. Petra Roach, who joined our team in July this year. We thank her for working with us assiduously to get to this point, and we look forward to hearing her remarks this afternoon.
Good afternoon, everyone who has taken the time to join us online for this very important discussion. I would like to preface what I'm about to share with saying that there has been a lot of thought, diligence, introspection to be able to get to this point. And actually, I'm very, very proud that we can now say that we are going to be welcoming back the first cruise ship on Tuesday. And I just wanted to take the time to put into context what has happened throughout the world, because that's always very important to put things into context. So we recognize that the pandemic has had an immense public health impact, and there has been significant death and suffering. And in March 2020, so just a little over 20 months ago, the cruise ship industry, which was previously one of the fastest growing segments in the global tourism industry, came to an absolute standstill, and hundreds of ships in the world's fleet idled, the crews were sent home, and employees were furloughed. And in 2020, we actually had a total of 5.8 million cruise passengers, and that dropped from a record high of 30 million in 2019, and there was the expectation that 2020 would have been another record-breaking year, and that would have been delivering 32 million passengers worldwide and an estimated annual value of more than US $150 billion. But in order to restart the industry, it was recognized that the public health risks which were associated with the pandemic had to be appropriately mitigated on board. And we saw the establishment of something which was called the Healthy Sail Panel, which was an initiative which was put together mainly by RCCL and NCL, and they solicited the help of an esteemed panel of medical experts. You're talking about experts in public health and infectious disease, biosecurity, epidemiology, to name a few. And they went through an arduous 4-month effort where they looked at every aspect of the cruise ecosystem, and they recommended the most effective and scientifically sound ways to make the cruise experience healthier and safer. And they set about developing very comprehensive protocols. In all, they had 74 detailed best practices for every part of the ship. And they looked at creating innovations to ensure, again, that we kept each and every one safe. They created a plan which was backed by science and validated by the best minds and accredited health organizations. And there were 5 areas of focus. There was testing, and the cruise lines, they've even developed their own laboratory testing capabilities on board their ships. There was screening and exposure reduction. There was sanitation and ventilation. There was response, contingency planning and execution, and destination and excursion planning and mitigating risk for crew members. And in each of these categories, the panel then went about creating recommended actions to address specific safety concerns. And all along the way, there has been constant dialogue and engagement with the CDC. And for those of you, CDC is the Center for Disease Control, and that's a federal agency which is run by the United States Department of Health and Human Services, as well as the EU COVID cruise guidance guidelines. There was also, in September of 2020, the establishment of the America's Cruise Task Force, of which Grenada played a part, and that was co-chaired by the Prime Minister of Barbados and the head of RCCL. So ultimately, there was and remains a priority to protect our guest, our crew, and also our people, and to reduce the risk of transmission even below the level that people would normally experience in other activities. The reality is that our understanding of COVID-19 actually evolves daily, and therefore the plans will continue to evolve to incorporate new science and practices and the ongoing advances in areas such as testing and therapies. And bringing it back to home, for Grenada, the last cruise ship call was March the 13th, 2020, and that was the Marella Explorer 2. and that had a capacity of 1,743 passengers. So that's, as I said before, 20 months ago or 605 days ago. Meanwhile, the rest of the world has resumed cruising. We saw that MSC Orchestra, they resumed in June in Venice. We had Norwegian to Alaska in August, and Iona did their maiden voyage to Scotland in August 2020. And closer to home, we had Barbados resuming on June the 7th with Celebrity Millennium. We had St. Lucia on June the 29th. We had August the 7th with Seabourn to Bequia. We had Jamaica on August the 16th with a call at Ocho Rios with Carnival Sunshine, and that's to name a few. So there has been a lot of thought dedicated by the government of Grenada, Carriacou and Petite Martinique to taking this next step. It's not been taken lightly. A lot of thought and introspection, recognising that our priority has to be the safety and security of the people here on the island, on the tri-state island. But at the end of the day, as Minister said quite eloquently, we have to also recognise that the livelihoods of each and every person is also incredibly important, and recognising and overlaying the fact that so much research and attention and care and detail has gone into ensuring that the protocols have been established both on land and sea. I think it's a recognition that now is the time that we can safely resume. And again, I wanted to put some more context into the conversation. So we had in 2018 our record year, and that was where we had 338,119 passengers, and that actually then had compared to now, that was 254 calls, and we now have 205 calls for this season coming. We will commence tomorrow with Star Clipper with 73 passengers, and then we have Marella and Britannia on Friday, and these calls will be managed in strict accordance with health and safety protocols as guided by the Ministry of Health and global standards in alignment with best practices. We're going to be implementing bubble tours, and those are tours which are restricted to selected locations on island, and interactions limited to vaccinated service providers. We will continue to work closely with our stakeholders to extend that bubble going along, again, a little at a time. Cautious wins the race. And therefore, we then extend that bubble to include other tourism sites that are compliant with the cruise protocols. As I said before, the safety of our people remains paramount, but hundreds of Grenadians are dependent on cruise for their livelihood, and it brings significant economic benefit as well. Just to give you a quick snapshot of our cruise protocols, I think Minister spoke to them, but again, just to go through with specificity. Number one, there has to be the proof of a negative PCR testing 3 days before boarding a ship for only fully vaccinated passengers. And fully vaccinated passengers means that no less than 95%, and that 5% then is the passengers who are 14 years and under. There also has to be full vaccination of all crew members, meaning no less than 98%. And that 98%, that 2% is in the case where you've got crew that are switching out, and they then are expected to go through a quarantine period for 14 days plus 14 days, so almost a month. All passengers must provide proof of vaccination upon disembarkation in Grenada. There has to be accurate reporting of all symptoms through the Maritime Declaration of Health form to the relevant team, which includes the Port Health Officer, the Chief Environmental Health Officer, and the Chief Medical Officer. There has to be immediate reporting of any positive cases of COVID-19. The ship has to show a demonstrated capacity to isolate, quarantine, and test for COVID-19. The ship capacity is actually reduced to range between 60% and 90% maximum, and that's to ensure that we promote social distancing. There has to be public health measures implemented on the ship: hand sanitization, mask wearing, and social distancing. And there has to be repeat viral testing of passengers and crew on board the ship. There has to be the detailed shore leave protocols and detailed home porting protocols shared with our team here on the island. So I pass back now to Nicoyanne, who will take us through the cruise operations checklist. But before that, we have a short video which will take you through what that process will look like.
Once passengers disembark, they will be greeted by the Ministry of Health team for health screening and temperature checks. Each passenger must then show their vaccination and identification cards. The dispatcher will then guide them directly to their chosen tour operator, where the guide will direct them to the police officer on hand for a secondary security check before boarding the tour buses. On the tour buses, the guide will welcome and brief each guest with the protocols that are in place for the health and safety of all. It is only after this process the bus will leave the terminal for the appointed tour.
Thank you, Petra, for guiding us through the global context on cruising. We looked at references to the Healthy Sail Panel's full recommendations, the CDC's guidance and return to cruising in North America and Europe, and the implementation of the America's Cruise Task Force led by the chairman, the president and CEO of Royal Caribbean Group, Michael Bailey, and Barbados's Prime Minister, the Honorable Mia Mottley. Grenada's public and private sector teams have prepared an operations checklist to guide us through as we have been looking at all of these documents and preparing them in terms of our own special considerations and the local context. The Grenada Cruise Operations Checklist has 4 different phases. The first phase looks at vessel arrival and berthing and preconditions for documentation from the ships and booking of the tours, etc., with our local port teams and the attractions. Focus on ship's capacity, the information required for all of the passengers going on pre-booked tours. These will be shared with the port agents 48 hours prior to arrival and with our customs and immigration departments. Any requirements for tours will be shared with the port security and the attractions, and all of our service providers are requested to walk with their vaccination cards, which will be checked at security control points at the Melville Street Cruise Center. The second phase of the operations checklist is the vessel arrival clearance by all of our local authorities, including the Ministry of Health. And here we have leadership from the port environmental health officers in terms of boarding and checking the manifest to understand that there are no COVID possible cases on board and going through all of the processes required for the granting of free pratique to that cruise ship. The third phase is reception at the different attractions, the experience that our guests will have on arrival, during the interpretation, and on departure from the attraction to go back to the port. All tours are now being pre-booked for capacity control and contact tracing management. And we have shared the information, the email addresses, the cell phone numbers. We've created a few more live interaction, WhatsApp groups to manage this process safely. Phase 4 is quite possibly the easiest phase because we will have gone through every single COVID-19 check that we know must be done while we're smiling behind our masks and giving the best possible service to our guests. And so scenario 4 is the vessel's departure clearance by the local authorities. Just to run through the arrivals for the week again, we have tomorrow the Royal Clipper. We have on Friday the P&O Britannia, which is a Carnival UK line, Seabourn Odyssey from the Holland America line. On Saturday, we have a call from Marella Cruises, and on Sunday, a call from Celebrity Equinox. I will now take any questions that are being posed. You can place your questions in the chat. Thank you. Posted in the chat as present. From our esteemed media representatives. If you have any questions, esteemed members of the media, please go ahead and post them now.
Good afternoon.
Good afternoon, Mr. Gerard Joseph from the GD.
Yes, the protocols would have been highlighted. We know that the cruise ships, the passengers would process of going out to be done in a bubble. Just for clarification, does that mean that the passengers don't mingle like normal within the Esplanade Mall as well as the vendors outside?
Thank you for your question, Mr. Joseph. The bubble tours are structured so that there is an added layer of risk mitigation so that the fully vaccinated passengers will only interact with fully vaccinated service providers at the destination. The tours that have been pre-booked and purchased are with the attractions that have received their pure, safe, travel approved, fully vaccinated status from the Ministry of Health and the Grenada Tourism Authority.
Okay, so in the long run, what happens to these vendors and others who would have been part of the industry for the last 30 years?
We are
We are
currently
currently
working with
with
all of the vendors to
to
ensure
ensure
that
that
during
during
phase
phase
two,
two,
we can
we can
have
have
more
more
vendors
vendors
who are fully
are fully
protected
protected
as
as
indicated
indicated.
by science with their vaccinations and as requested by the guests of the cruise lines.
I just wanted to make a comment here. The caller has asked a very important question, because the vendors are an extremely important part of the provision of service, and certainly in terms of income generation, they are also of concern to us because we look at this in a holistic way. What has happened is, because of the extensive dialogue that was well detailed by our CEO, Ms. Petra Roach, we find ourselves sort of close to the deadline where we couldn't interface with all of our stakeholders because we needed to be sure that, one, we had some level of agreement and that cruise ships were coming. And therefore, we are a little bit on the back end of having dialogue with all of our stakeholders, who included the vendors. And we had to prioritize the major ones who have direct linkages with the cruise lines and so on, to get to this point where we are, and to get a sort of light at the end of the tunnel, to get to that light in terms of the agreements on both sides with the protocols. And therefore, in the next few days, as Nikoyan said, we will be engaging them, and we will be facilitating them in whatever way necessary so that they can fit into the protocols, whether they need some assistance in getting vaccinated, whatever needs to be done. And so over the period until May, we expect them to come in quickly. Those who are vaccinated, we're organizing them already in some areas. Those who are not vaccinated, we are going to work with them to get them vaccinated so that within the next month, it takes you 21 days for the vaccine and then another 14 days. Once persons are fully vaccinated, they will be incorporated. We couldn't wait because we had gotten to the deadlines of the arrivals, but we intend to work with them so that even if it's to a significant portion of the calls, they can still capture that and be able to vend. So we're working on that aggressively and very assiduously, I must say. And within the next, some persons may have had their first vaccines. They are in varying stages of vaccination. Some are still considering, but we will be there to support them so that they make the decision that will bring bread and butter on their tables.
Thank you, Minister Modeste Kerwin. Do we have any more questions?
I have another question. In terms of vaccination hesitancy, which has been a major hindrance to people becoming fully vaccinated or even taking the first dose, GBN interviewed a couple of vendors right in front of the Esplanade Mall, and they expressed their unwillingness to be vaccinated at this time. What would be done in such a regard when somebody expressly does not want to be vaccinated?
I think from what has been said before, one can easily conclude where this is going to take us. The persons or visitors have certain requirements. They have to meet certain protocols. And so our service providers have to meet certain protocols. And this is where we're going to get business happening and transactions happening. We are aware that vaccine hesitancy is a reality. We are working, and we see our numbers growing slowly, a little bit too slowly for me, but that is where it is. And in the meantime, you would have heard that upon disembarkation, that our guests would be asked to show their vaccination cards. Our service providers, whether it's the tour operators or whatever, they would be asked to show theirs. And therefore, vendors will have to comply with the same so that business could happen. Because this is one of the agreements with the cruise ship. And therefore, they will be asked to show it. And I hope that answers your question. You can understand the implication there that for safety and protection of our nationals and also for visitors, vaccination is the common factor there, the common denominator, and that is where what we have to comply with in order to get the cruise ships to agree to come to our shores. And that's what every other island is doing.
Just said, please be reminded as well that we have a hotel sector that is pretty much 100% vaccinated, and the hotel sector has reopened and has, unlike other sectors in Grenada, which during the spike had massive interruptions, the hotel sector did not, and the reason for that is not that the conditions in a hotel are pretty much the same as any other business place. The difference is that the workers and the guests are 100% vaccinated. So we want to create a safe environment for everyone. And while we want business to come back and we want it to come back fast, safety is important. And the way that you keep yourself safe is through vaccination. You cannot enter the United States unless you're vaccinated. You cannot, you go to, I was just recently in New York, you cannot sit in a restaurant unless you're vaccinated. They ask you for your vaccine card. You cannot sit in a cafe. You cannot go to a club unless you're vaccinated. The rest of the world is recognizing that, and we have to recognize that as well. We have led in terms of the long stay sector. In terms of vaccinated, we may be one of the few Caribbean islands where we have 100% vaccinated, or pretty much 100% vaccinated hotel staff. And that's something we should be very proud about. We have to commend the hotel workers for taking that step. They deserve a lot of credit for taking that step. And their industry is continuing to grow. And you look at the numbers, the hotel sector. In fact, the only reason why the hotel sector is not growing as fast as we would like it to, or recovering as fast as we like it to, the feedback that we are getting is that some of the measures that we have to implement to protect the unvaccinated population are impacting the hotel sector. We have to take the measures because you have to keep people safe, but we realize that the economic recovery will not be complete without a certain level of vaccination. So we can run, we can creep, we can walk, we can crawl, but it all depends on somebody, I just read an article in The Economist which was saying, how did India beat COVID? And it says India didn't beat COVID, COVID beat India. And so many people got COVID along with the vaccination campaign, that so many people had COVID, although they were vaccinated persons, that the numbers are dropping. We don't want that to happen here. We got a taste of it with a spike. We don't want any more spikes, so we've got to have people vaccinated. The minister is absolutely right. We've got to do a lot more consultations. I think we've done a lot of consultation, and we have to do more. But every day there's another chance to do more and more consultations. But we want to have a safe. Just like the hotel workers, we want to have a safe cruise sector. We don't want interruptions. We don't want to have a short-term measure where some people, we get some gain today and then tomorrow you have to shut it down again. We want to be safe.
Thank you, Chairman Collymore. Do we have any more questions? If there are no more questions, we thank you for your attention this afternoon and look forward to your support as we engage in this safe resumption of cruising into Grenada. Have a blessed evening, everyone.